Everywhere we look, we see pieces of God's miraculous creation. Horses capture the majestic nature of his creation, such power, yet such grace. The enjoyment of working with horses transcends past age, language, and mental barriers and speaks to the soul of a person. In order for us to continue enjoying these beautiful animals, they must be well taken care of. This includes being aware of the common equine viral diseases so that we can recognize, prevent, and treat them as needed. I have learned from experience, and I have researched equine science both for personal interest and for competition. I have ridden horses for 7 years, and I have shown horses for 5 years. I have also contemplated career options in the equine science field. Today I would like to share with you some symptoms, treatment options, and preventative measures of some of the common equine viral diseases. First is equine influenza. Equine influenza is one of the most commonly seen respiratory diseases in horses. It is very contagious viral disease, but it is not usually fatal. It is caused by the moxie virus. According to Plotter from West Virginia University, symptoms of equine influenza include fever, mucus, and harsh, dry cough. In veterinary world, Wagner says that the two primary treatments are rest and supportive therapy. In this same magazine, Wagner gave the preventative options. This includes vaccination, both injectable and intranasal. Your horse must also be quarantined from all other healthy horses, and anyone who treats the horse, along with any equipment used, must be thoroughly disinfected. Now that I have told you a little bit about equine influenza, I will go over equine infectious anemia, also known as EIA. This has 3 phases: acute, subacute, and chronic. It is usually spread through saliva, but can also be spread through urine, blood, milk, and blood through the bite of a vector. Symptoms listed by Pipetti of Equine are fever, weakness, rapid weight loss, sweating, swelling of the limbs, and anemia. There are no treatment options or cures for this disease, and the outcome is usually fatal. There are no vaccinations. However, there is a Coggins test, which is a blood test that is able to detect the presence of equine infectious anemia. Your horse must have a current negative Coggins test before it is allowed to be transported off of the owner's property. Another equine viral disease is West Nile. West Nile virus is a viral disease that is spread through mosquitoes. It can cause encephalitis or meningitis in horses. Symptoms of West Nile by Pipetti on Equimed include skin twitching, muscle trembling, facial paralysis, listlessness, weakness, and disorientation. Pipetti also listed treatment options. These include supportive care, fluid therapy, intravenous feeding, and the utilization of a sling to hold the horse in an upright position if the horse lacks the strength to stand independently. There are vaccines for West Nile for horses, but there are none for people. Another equine viral disease that is much like West Nile is equine encephalomyelitis. This has 3 forms: Eastern equine encephalomyelitis, Western equine encephalomyelitis, and Venezuelan equine encephalomyelitis. This is also a viral disease that is spread through an infected mosquito. The symptoms of equine encephalomyelitis, according to the Virginia Department of Agriculture and Consumer Services, are fever, depression, staggering gait, a loss of appetite, and fatigue. The Virginia Department of Agriculture and Customer Services also listed treatments as hospitalization, respiratory support, and intravenous fluids. There are vaccinations available for all 3 forms of equine encephalomyelitis and are administered according to their region. Officers of the state veterinarian suggest the removal of any standing water that could be a breeding ground for mosquitoes, the use of an insect repellent, and to remove your horse during peak times such as dusk to dawn. Being knowledgeable about common equine diseases can help horse owners and riders have healthy horses. Preventative measures are often more important than treatment options because most of the diseases that horses can suffer from result in death. By working to ensure the health of each horse individually, horse owners are also working to ensure the health of all horses by stopping the spread of contagious diseases. It is important for us to learn our horse, learn their normal temperature and breathing at rest and activity. It is important for us to learn their movements and their eating habits and their disposition. Because when you know your horse is normal, it is easier to identify when something's off. By staying knowledgeable, horse owners are more likely to have horses in optimal health.